Hello, my name's Taylor. I'm going to be your student nurse today. So we're going to make sure we have the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. I'm going to check them all right now, see what we have. Can you tell me your name and date of birth? Okay, so the patient verified name and date of birth. Have you ever had an IV before, or an IV solution ran through you? No. Okay, so what we're going to do is we're going to put a needle in one of your arms, probably right here on the back of your hand. Looks like you got some good veins. And then this is going to sit for 6 hours, and it's going to put some fluids back into your body. Okay, so I have the 9% sodium chloride solution. So I'm going to write the patient's name, the date, my initials. We are going to label this with the infusion rate, the start time, and the stop time, which right now looks like about 22:20. And it's going to be, we're done at 4:20. And it's going to be 6 hours. Okay, so next we are going to get the tubing out. Looks like I have a 10 drop solution set. So we're going to open this up. I'm going to try and keep everything sterile here. We're going to get a label, and we're going to put the time and date on the tubing. All right, so we're going to maintain sterility, and we're going to spike it. Close the roller clamp, which maybe I should have done just a second before that. All right, and we're going to go ahead and bleed it. There we go. Put that cap on here. Okay, now we're going to start your IV. So I'm going to perform hand hygiene. I would have performed hand hygiene when I first came in too. Actually, yeah, I'm going to perform hand hygiene. There's my sharps container. I have a sharps container nearby. All right, so you said we can go ahead and do this one, this arm. So looks like the dorsal surface of the hand has some pretty good veins here, so I think we're going to shoot for that. So we're going to set up our tourniquet. I'm going to palpate the radial pulse. The vein has a good rebound. Okay, so we're going to Let that off for a second. Now I'm going to perform hand hygiene. Put my gloves on. Before I get too crazy, we're going to prime the saline lock. Which I don't know why these always have to be backwards. But they do. I'll still stay up there. So we're going to run 1 to 2 milliliters out of there. Nice and slow. We're going to make sure that this stays sterile. So that's going to be right there, not touching anything. Still has the sterile cap on it. We're going to put this linen saver underneath the patient's arm. I have a 20 gauge 1-inch catheter that we're going to be administering or putting in. We're going to put this 6 to 8 inches above the insertion site. Alright, so we're going to crack this open. Clean the site. I didn't see it in the thing, but I'm pretty sure somebody said do it twice, so we're going to do it twice. We're going to let it air dry. We're going to make sure the catheter part there is loose. We're going to make sure we have the bevel up. I'm going to hold down on the vein while inserting. We're going to put your arm over here just a little bit more. There we go. So, I'm going to hold down on the vein and back. I'm going to insert until I get a little bit of flash. There's my flash. So I'm going to come down, move the catheter forward. Pull my needle back. We're going to put pressure on there. I thought I grabbed a safety one. Guess not. I'll put that in my sharps container. We are going to re-sterilize the site with a clean gauze pad. We are going to insert the saline lock, which we maintained our sterility. We're going to go ahead and put 1 to 2 mils in to make sure we have patency. Alright, so we're going to put a gauze pad underneath. We're going to put our Tegaderm over the top. And the checklist said Tegaderm and then tape. So, I don't know. There, tape that in place too. Alright, so I need another piece of alcohol. Alright, so now, oh, that would have came off after I put the saline lock on. So now we're going to clean the end here. We are going to clean this end with a new alcohol swab. We're going to put this in. We're going to tape this in place so it doesn't move around. So while I'm taping this in place, the reason I'm taping this is because we don't want that line kinked, moving around, anything like that. So we want to be watching for that. If you need to move, you need to do anything with this arm or you think it's going to compromise that line, why don't you let me know. And we're going to close. While the clamp is closed, we're going to fill this, which I should have done before I hooked up. Alright, so now we want to do our infusion rate, which is 1,000 milliliters in 6 hours, which I came down to like 167. Divided by 60, it comes out to 2.777, so we're going to shoot for 28 drops per minute. So now we're just going to start timing here. A little fast. Twenty drops a minute. We should be running about 1 drop every 2 seconds. Let's slow that down a little bit. That looks better. That's still way too fast. There we go. Okay, so I'm going to move the bed down. We're going to put you in a nice comfortable position. We're going to do a little cleanup here. I'm going to leave you with the call light, and if you need anything, push the button, let me know. Make sure that we keep this line nice and clear, all right? And I will be back in 1 hour to double check my drip rate and make sure that there's nothing obstructing the line or it's not occluded and we still have our patency in the line.